Today's first question. A 2-week-old infant presents with a history of epistaxis, a recurrent rectal bleed. The parents also reported a history of bleeding from the umbilicus since birth. Lab investigation revealed normal prothrombin time, normal partial thromboplastin time, normal platelet count, and normal function. Urea clot solubility test was positive. What is the most likely deficient factor in this patient? Factor 13, factor 11, factor 10, factor 12. What do you think is the right answer for this question? This question is very simple if you know the concept of bleeding disorders. As a study partner, it becomes my responsibility to let you know all the important concepts. You can't go to the exam without knowing the concept of bleeding disorders. It nearly takes me 10 minutes for you to explain all the bleeding disorders. So my suggestion would be, if you are following Preeti ma'am from PrepLadder, open the bleeding disorders topic from the PrepLadder app and finish it. It will only take 1 hour, but 1 to 1.5 hours, but you will be very clear about all the bleeding disorders. If you are following Marrow, then use Marrow. If you are following Cerebellum, any app you are using, finish the topic of bleeding disorders and get done with this, because this has been asked in INICET November 24, and also von Willebrand disease question has also been asked in NEET 24. So this question is really very important. The only clincher in this question is urea clot solubility test was positive. While solving questions, there would be some keywords that if you know the keyword, you'll directly know the answer. Here the keyword is urea clot solubility test is positive. Urea clot solubility test is only done for factor 13, which is also known as the fibrin stabilizing factor or clot stabilizing factor. So as the test was positive here, this answer can be marked in less than 30 seconds. Here the answer would be factor 13. Coming to question 2. Yesterday we have read the concept of jaundice. See, another question from jaundice has been asked in INICET November 24, saying it's an important topic again. So here, what are true about breast milk jaundice? I hope and believe you completed the topic of jaundice yesterday, so you can answer this question quickly. Breastfeeding should not be continued. Most of the children required phototherapy. Exclusive breastfeeding with total bilirubin more than 10 mg per dl after 3 to 4 weeks of birth. Conjugated hyperbilirubinemia. What do you think is the answer for this question? Here, in the case of breast milk jaundice, which is normal in the case of most of the neonates, breastfeeding should not be continued. This is false statement, so this is not the answer. Most of the children required phototherapy. No, this is not the answer. It's a case of unconjugated hyperbilirubinemia, not conjugated hyperbilirubinemia. So this is also not the answer. If you don't know the answer also, by ruling out and just simply putting your logic into this question, you can solve this answer. Here the answer would be exclusive breastfeeding with the total bilirubin more than 10 mg per dl after 3 weeks of birth. This is the direct explanation of the meaning of breast milk jaundice. So now read the complete the topic of jaundice at any cost. Coming to the next question, which of the following is true regarding pediatric CPR? During the exam, I have completely read everything about CPR, but I didn't concentrate on pediatric CPR much, and they have asked the same question. Here, they're asking what is true. Chest compressions at the rate of 30:2 with 2 rescuers. Adenosine via interosseous is preferred over other methods. In chest compression, depth must be at least 1/3 of AP diameter of the child's chest. Adrenaline given in the dose of 0.01 mg per kg IV or IO in 1:1000 concentration. What do you think is the answer to this question? Here in the 4 options, if you don't know this and if you suddenly see it, we feel as if all the options are correct. So you need to know the correct values to answer this question. In the case of pediatric CPR, chest compression at the rate of 30:2. It's not 30:2 with 2 rescuers. It's 15:2 with 2 rescuers. Adenosine via interosseous is preferred over other methods. Adenosine is not used in the case of CPR. Adrenaline is used, not adenosine, that too in kids. So this is also not a correct option. In chest compression, depth must be at least 1/3 of AP diameter of the child's chest. This is a correct statement. Adrenaline given in the dose of 0.01 mg per kg, IV or IO in 1:1000 concentration. Here, it's not 1:1000 concentration. Whenever we give adrenaline 0.01 mg per kg, it's 1:10,000 concentration. It's just simple. You need to remember this at any cost. While seeing this question directly, we feel, though we know the correct answer, we feel sometimes confused. Is this the correct answer? Is this the correct answer? So if you know your numbers well, if you know your concepts well, you can easily answer this question. Fourth question, all of the following are examples of HAGMA, that is high anion gap metabolic acidosis, except. This is a simple question that has been asked in INICET November 24. The acid-base disorders, acid-base imbalance questions are very important. In this way, complete this topic at any cost, because one question from this topic is compulsory. Here, what do you think is the answer for this question? This question, comment in the comment section this answer. I'm expecting you to comment this answer because it's simple. Coming to the fifth question, a lady with recurrent bluing of hand and stretching of skin. She also had difficulty in swallowing and lung lesions. What is the diagnosis and pattern in the ENA? As you can see the pattern, if you know the pattern over here, you can answer this question. So the options are speckle pattern systemic sclerosis, anti-centromere pattern systemic sclerosis, nucleolar pattern SLE, homogeneous pattern SLE. The given explanation doesn't account to SLE at any cost. So because bluing of hands, stretching of skin, all of these are Raynaud's phenomenon, which is not seen in the case of SLE. It's seen in the case of systemic sclerosis. Even if you don't know anything, but if you know perfectly the image shown here, that is the anti-centromere antibody, you can directly mark this answer as anti-centromere pattern systemic sclerosis. I have pinned a beautiful video by Ranjit sir in the description, where you can watch that video and remember the 5 patterns of ANA, that is the anti-nuclear antibody patterns, because that's very important for the question, as it's also been asked in the INICET 2024, the question which you just saw. If you simply see homogeneous or the diffuse pattern, here the antibodies are against the chromatin, histones or double-stranded DNA. Here the pattern is all homogeneous. Remove the peripheral pattern. Here the antibodies are against the anti-double-stranded DNA. Anti-centromere antibody. It's in the case of systemic sclerosis and also in the case of Sjogren's syndrome. Speckle pattern, it is a most non-specific. If you see the speckle pattern, we can't justify that to a particular disease. Nucleolar pattern, again it's specific to systemic sclerosis. So the main idea I want to make this videos is that I want you to read the concepts which are important. Most of the times we keep on watching videos, reading things which don't even appear in the exam. I want you to read the high yield points which has high capacity to be asked in the exams. So I did the same way. I used to concentrate only on very high yield topics, and whichever I felt not important, my feeling that the chances of this coming in the exams are less, I used to simply leave that topic. Even some random question appeared in any GTs also, I used to not concentrate on that, because PYQs are an important source. PYQs give us a direction that these questions can be asked. So think it that way, and all these 5 concepts, the bleeding disorders, the jaundice, CPR, acid-base disorder, and this, all these 5 concepts are important. My motto here is not making you understand each and every bit of this. My motto is for you to understand these topics clearly by yourself and not missing a single question if this comes in the exam. Hello guys, are you comfortable with this type of videos? Because I am posting daily 5 questions to keep you motivated. Time is not sufficient for me to explain all the explanations of each question. So if is this fine, or should I take a single question and think like an examiner and give you all possibilities examiner can ask from a single question? What do you think is the best? 5 questions or a single question and all the pertaining related questions regarding that? I will post tomorrow a single question and the mindset of that. You please comment whichever is comfortable to you, so that whatever time we are investing, it shouldn't be a waste. Even 1 minute you are investing in my video, that should be helpful to you. That's my only motto. If you're liking the videos, please like, share with your friends, and thank you. See you tomorrow.